Clown. All right, we want to welcome our viewers and listeners today. Today we are live with Mike Bukner. Mike Bukner is a longtime resource partner with Weave, and Weave is a longtime Crown Council resource partner, and we are thrilled to have him, especially on this topic today as we begin to get closer to reopening our doors and our practices. And, it's been a major initiative of everything that we have been sharing to maintain ongoing communication with our patients, and especially in preparation for reopening doors and just maintaining the touch of being in touch with our patients. We are thrilled to have Mike and We've talking about patient communication with us today. And so, Mike, welcome and thanks for your time and being here.
Thank you. It's good to be here. Love our Crown Council members, and I'm excited to kind of talk through some of the technologies and some of the ways that we found offices are finding new ways to connect with patients. So
that's great. Mike, you want to know, just to kick things off, and I'll turn it right over to you. In the Crown Council, one area that I love about Weave is on my desktop, I am able to just message out to our members questions or even requests for like a review, and they go on and they add a review or post something nice about the Crown Council. But it's an awesome way for us to communicate with each of our members. It's one thing I've been able to learn over the past few months, and we are also have been a long time Weave client. We use the system here in our office. So Mike, with that, I'm going to turn the time over to you and share with us as we enter into this kind of new wave going forward, how we can utilize your products and services.
Sounds good. Thank you so much for the time again, and it's good to be with you. So yeah, if at any time there's any questions, please feel free to reach out and let me know what questions you might have. But yeah, I think that it's almost become cliche, and the amount of times, like if I had $1 for every time I heard, on the radio, TV, uncertain times and times of uncertainty and stress and everything else, man, it can get to us. And the one thing that we all have in common right now is really this, the coronavirus that has really kind of just made the whole world come together to fight this. And, it's easy for us to get stressed out and frustrated at some of the barriers that we have and some of the restrictions that have been put in place. But also I love kind of taking these times of stress and uncertainty and disruption and kind of using it as a time for us to, reassess how we run our practices, reassess, truly what's important. I know for me, I kind of traveled quite a bit over the last 10 years just in my career. And, when all of this took place, it was stressful and it was very uncertain. And I kind of wondered, man, how are we going to continue, with how, especially the dental industry is so connected through events and man, we're all over the place. Spencer, I see you at so many meetings, and, but this opportunity to be home, it's easy for us to focus on the negative, but one of the things that I am truly grateful for is being able to just refocus on family. And I get little glimpses, little moments that I otherwise would not have if I were at the office. And one of those I have to share with you. I have twin boys at home, and I get to see little moments like this. I was able to capture this that otherwise I wouldn't have been able to see. So I think it's important for us that during times of disruption, to really just focus on what good can come of it and use it as a time for us to reassess how we do things. One of the things that's certain is with disruption comes change. We saw that with, for example, with like 9/11. When 9/11 hit, before 9/11, man, you go to the airport, you could walk right up to the gate. I remember growing up and we would go to the gate to greet, my father coming home from his trips. And you can't even imagine that anymore, especially today, because certain things that take place require us to kind of think outside the box, to think of, okay, how can we make things better? How can we improve safety and improve our processes? So we're finding a lot of that's coming out of, what's currently taking place. So the couple areas that I just wanted to focus on today that we kind of, grouped together, at Weave and with other industry experts to determine, okay, where are things going to be shifting after this COVID shutdown? What is going to be the new norm? And what practices were very commonplace before that will probably change, and not just for the next few months or weeks, but we will probably see some huge changes that will carry on probably indefinitely. Some of those things, for example, patient forums. Not only patient forums, but wellness screenings. Being able to screen those patients before they come in. Waiting rooms. There's been a lot of talk about waiting rooms, and how even just, congregating or trying to maintain that social distancing. How are we going to set up something as commonplace as a waiting room, and that practice that we have of having patients come in and sit all together for their treatment before they go back. Payments and transactions. I've done a lot of research on this one, and I'm excited to share some of this stuff with you. But even just how we transact business, it's like there's nothing to do anymore, it seems like, except for to go on walks and go get takeout. And it's almost like Groundhog Day. So it's like, man, what do we do today? I don't know. Let's go through the drive-thru. And even when you go through the drive-thru or go get takeout, like, people aren't handling your credit cards. They put the machine out the window, so that you insert your credit card. So even things like that, we need to be thinking about, okay, what changes are we going to make in our practice for when we reopen the doors? And then last but not least, and I think most important, is maintaining the patient care and communication in instances or situations where it might be required to communicate remotely. So, maybe to start off, I just want to go through and maybe just talk about patient forms and wellness screenings. This is something, at least patient forms, this is something that is not new to the industry, paperless forms. Whether you have an iPad that you're passing around or whether you're sending a link out for patients to fill out their patient history or intake forms before they come in, that's not something very new to the industry, but I think going forward, it's almost going to be expected. And then the second part of this is wellness screenings. Two different things, very similar, but two different things. So this whole practice of even just coming in and even giving them an iPad or a clipboard or a pen, I think that this will absolutely change and be very different. I know when I go to a store, if I pay with a credit card and they give me a pen to sign, I tell you, I'm a little leery now. I don't want to touch it. And I've heard doctors even say, even if you're wearing gloves, even if the person at the front is wearing gloves, or the cashier, for example, is wearing gloves, that does nothing for you. All that does is obviously, protect them, but everyone else who's handled that pen. What's interesting, when I started looking into this, the pen in an average doctor's office that is passed around for patients to fill out their health history, the average pen in a doctor's office has 46,000 times the germs than the average toilet seat.
Oh,
now, if that's not enough to make you want to throw up, I mean, that's disgusting. But we're going to see that when patients come in, they're going to be very leery of what they touch in the office. So we've got to find ways to kind of overcome that. Now, I know that recently the ADA, they sent out kind of a back to business toolkit, right? And in there, they had some suggestions for wellness checks or wellness screenings. One of the things that I wanted to suggest, now, whether you're using Weave or another system, this is something that Weave does, as they basically can send out an automated message, before the patients come in. You can send out this text message to all of your patients that basically says, hello, Jonathan, due to the spread of COVID-19, we require you to fill out this form before you come into our office to ensure that we can honor your appointment. And that form right now, when they click on it, they put their information in there, and then it goes through a couple screening questions. And real time in the office, you're able to see the responses so that if you have a liability or if you can bring them in. There's other solutions that we'll talk about if maybe you just need to do a consult. But the wellness screening forms is a way to, before they come in, fill out this form, and you're able to see those responses and make sure that it's safe for them to come in.
Mm-hmm.
That's something that is automated. And I would suggest, again, whether you're using Weave or not, look into the systems that you have to see if you can send a link out for them to fill this out before they come in. Because the last thing you want is for them to come into the office, fill out this screening form there with the pen or whatever, and realize that, oh, shoot, you know what? Probably shouldn't have come in.
Yeah, they click yes on I'm super sick.
Yeah, actually, turn around and go back home. And then the second part of this, really quick, is just the paperless forms. There's a lot of companies that do paperless forms already. I know that we offer paperless forms that actually write back into the practice management system. So Dentrix, EagleSoft, Open Dental, you can send that link out to your patients to fill out their intake forms before they come in. So that all of that is done and taken care of, and it writes back into the majority of practice management systems. So before we continue on, any questions about the forms, paperless forms, or wellness screenings?
Mike, while we are waiting for anyone to enter their questions, just a comment from me would be, what a way to maximize time as well versus, all of this, they can be done from their house or on their way in, whatever, just saves time, maximizes the time you guys have in the office to just have them come in and go right in because there's no more waiting.
Yeah. And I think that time is going to be one of those things that we're going to have to play around with, time management, because there's going to be more requirements for, cleaning surfaces, for changing out your PPE, for, we don't realize yet what kind of additional windows of time we might have to schedule in. And so really just taking advantage of anything that we can do to improve our processes, improve the efficiency, so that when that patient can come in, boom, we're ready to go. We can get them in, get them out, and not have them, congregate or wait around.
Mm-hmm.
So if there's no questions, we can jump in and kind of talk about, okay, you've had the patient fill out their screening form. They're good to go. They can come in. They're not sick, and they've even filled out their paperless forms before coming into the office. Now, waiting rooms. I know with my twin boys, anytime we go to the doctor's office, you've got like a healthy door and you have the unhealthy door. I hate that. And I know it's good to have, because if my boys are healthy, yeah, I don't want to be in the same waiting room as sick kids. But unfortunately, if they're sick and I've got to go over to the sick side of the waiting room, who knows what other germs are going to come in contact with. Waiting rooms and the social distancing that I think we're going to see carry on, not just when offices open back up. People are going to be a lot more aware of this. So how are you going to operate your waiting rooms in the office and having patients come and wait for their treatment? So one of the things that maybe has been talked about, kind of gone viral and throughout the industry, are these curbside check-ins or these mobile waiting rooms. Because this right here, this is great. This was the norm, and there was nothing wrong with this. But I think going forward, people are going to be just a little bit more leery of coming in and waiting around with people. So one of the things that I would recommend is to create this virtual or curbside check-in or mobile waiting room. And you can do this with text. With Weave, you can actually automate this. So a text goes out that morning to all the patients, and a text basically says, "Hello, Mike, to help maintain social distancing, we ask that you text us once you have arrived. Please wait in the comfort of your car until we're ready to bring you back, until we're ready to see you." Now, they've already filled out all their forms, their paperwork, so all of that's taken care of. They pull up, and they're able to just text, "Okay, I pulled up, I'll wait for your text." Now, whatever system you have, like Weave, it'll pop up on the screen. You'll see that patient has texted back. They're here. They're waiting to be invited to come on back. Other systems out there, just, if you want to text out your patients, just make sure that you're checking those text messages. That's a way to do it. But as soon as that patient texts back, and you're ready to bring them back, then you can text them and say, "Okay, we're ready for you now. We're looking forward to seeing you." And so when you do that, what you're doing is a patient, it kind of instills additional trust in the patient that, okay, you know what? I know that this office is really taking it seriously. I don't have to wait. And as soon as I'm ready, boom, I can go in, get my treatment done, and I'm out of there. And so again, this is something that I would highly recommend, is setting up this curbside check-in, like this mobile waiting room. And again, Weave can do this automatically, before the patients come in that day, sends this text message out. But that just kind of helps with what we think will be the norm, going forward. Any questions about curbside check-in or mobile waiting rooms? I'm actually curious, is anybody currently planning or doing something like that with their emergency procedures that they're seeing? And yeah, I don't know if, I've got some comments on here that there's some people that are currently doing this. So that's awesome. And, would love to hear your feedback on how that works. Obviously this is something new, and could become kind of the new norm. But as you're experiencing this, as you're implementing some of these things, I'd love to hear the feedback on how that's going.
Yeah. I mean, today, Mike, I would prefer to pull up, just sit in my car, and then have someone just say, "Hey, we're ready for you. Come on in." And you walk into a clean office, at least for the current time, for a little while further, I would, rather than sitting around with everybody.
Well, what's interesting too, I've actually talked to a couple offices that are planning to completely have their front office team work remotely. Mm-hmm. And you think about that, it's like, okay, well, how would you do that with all the different steps but if you implement something like this too, and you have a system to do team chat or to communicate in the office, you can save that PPE, that protective gear for the dental team. It's actually going to be working on patients, and you can actually have either your front office team working in a different part or working remotely, and you can basically message somebody in your office and say, "Okay, Jonathan's ready to come back. Go meet him at the door," and somebody will come meet him at the door, take him right back, and treat them. So it'll be interesting to see how offices do this. Some are going to try this, working remotely for some members of their team. But yeah, that's something that I think can improve that efficiency, and again, save that PPE for your dental team that's working on patients. So the next part of this then is kind of just talking through payments and transactions, how we actually collect payment. And again, there's a lot of studies around, cleanliness, hygiene, the germs on surfaces. And when I kind of looked into this, there is a scale of how they rate how clean, certain surfaces are. And a lot of this is used in the restaurant industry. Now, to kind of put this into context, and not to scare you, but to put this into context, the surfaces of a restaurant, to go in and to sit at a table, if that's ever inspected, it needs to have a germ scale or a cleanliness scale of 10 or less. okay, 10 or less. Now, again, just giving context here, that right there is like considered, it's approved, it's clean surface, good to go. To put that into context, the urinal at Penn Station, okay, has a scale of 163. So obviously there's a huge gap, a lot of germs there. But when you're thinking about currency, when you're thinking about coins, and you're thinking about dollar bills that are being passed around to who knows where that's been, or even credit cards. I'm just curious, what do you think would be dirtier? Coin, currency, credit cards? And I'm gonna ask you, Spencer, because I don't know if anybody else is on mute, but
Yeah. I would say that the currency has got to be the most dirty.
Yep. Honestly, that was kind of my thought and my impression as well. And when I looked into this and I saw the scores, currency has a scale of 165. So technically dirtier than a urinal at Penn Station.
Yeah.
Now, what freaked me out, and as soon as I read this, is that the average credit card has a germ scale of 285. What that means is, you think about that. I don't carry cash around. I mean, I use credit card for everything.
True.
And so that has been passed, when I give it to the waiter at the restaurant, they take it back. Who knows where that goes, or the cashier at a gas station, or even at the pump to pay at the pump. So those are like germ infested, and those plastic ones especially, that can hold on to those germs and those particles. It's disgusting. As soon as I read this, I tell you, I went and I Clorox wiped all of my credit cards. It kind of freaked me out a little bit. But again, this is something that I think will change how we transact, how we pay, and how we do business. Now, I know that when I go out now, everywhere I go for takeout, I always ask, do you have Apple Pay? Do you have a mobile pay? Can I just use my watch to make a payment? Because I hate passing my card to someone who is wearing gloves, good for them, but the gloves don't do anything for me.
No.
The gloves don't do anything for me, and how many other credit cards have they handled? So that becomes just a breeding ground. It's germ infested. So I hate that. And I always ask, do you take Apple Pay? Do you take mobile payments? And what I'm hearing is a lot of places are saying we're getting it soon, especially because of COVID. But I think that that's going to be the norm. And when you think about that, I know that it's easy for us to think mobile payments, Apple Pay, Android Pay, those are things that you would typically use for like going to the grocery store, or just at the gas station, or even like Starbucks. Now, Starbucks, like, they were ahead of the game. They knew where this was going with their mobile payments, because there are more people that use the Starbucks app than Apple Pay and Android Pay. So they knew where this was going. On top of that, they reward you with like stars so you can get free drinks. But for the people who have that as their daily routine, they don't go through and go into the store and wait in line. No, they walk in like they're freaking royalty, right? They walk in and they've already made their order. They pass all of the people in line and come up, grab their drink, grab their order, and walk out the door like they're VIPs.
Yep.
And so, and it's not, you think about the app, you think about the Starbucks app, it's not that easy to use. I mean, you've got so many other options, so many places where you have to go, whether you're doing a tall, grande, venti, soy, double shot, whatever. It's actually a little bit difficult to use and to order your drinks, but people do it and they adapt, and it's become the norm. Now there's apps for everything. And in fact, one of the things I wanted to share is when Tesla, when Tesla came out with their Cybertruck, I went on to just check it out. I went onto my phone. When I went on, I saw down at the bottom where it says order now. And I thought, there's no way. Like, you can't really order a car on your mobile phone. But I clicked on it. I wanted to see what it did. Clicked on it, and then it gave me 3 options. Do you want the single, the dual, or the tri?
Yeah.
And I'm like, man, that's no different than Starbucks basically saying, do you want the grande? Do you want the venti? Do you want the Trenta? And so I clicked on one of them, scrolled down to the bottom, and basically it says Apple Pay. Boom. Due today, $100 down payment. You can literally order a $70,000 car with Apple Pay, with your mobile phone. You can make a down payment on that. So we have to shift our mindset from thinking that, okay, Apple Pay, mobile payments, that's something for coffee or whatever, because no, this is going to be the norm of how people even transact business on a larger scale. So in your dental practices, having the option to text a patient where they can click on a link, they can see their invoice, and they can make that payment with a credit card, with Apple Pay or Android Pay is going to be key. And that's going to, I think, become the new norm. And on top of that, your credit card processing machines that you have in the office, just think about that. Do they take Apple Pay? Do they take Android Pay? Can they just scan and make that payment? Now, if for the Weave users that are out there, if you're not using Weave payments, we actually have credit card processing terminals, and it's synced in with Weave. So you can get these credit card processing terminals for your office. It can use Apple Pay, Android Pay. The rates, for the most part, we can either beat or match your rates, is what we're seeing. For most offices, it switched to Weave payments. So having that as an option to make payments, not just with your watch with Apple Pay, but also sending a text out to collect payment, might be a way to minimize that contact with credit cards and currency and everything else.
Hey, Mike, here's a question for you. Does the Stripe account I set up for text to pay include Apple Pay?
Yes. So for the text to pay, if you're using Weave right now, that text that goes out on their mobile phone, there'll be a little Apple Pay button, and they can just click and make that payment. Now, if you want to have the credit card processing terminal in the office where they can come in and use their phone to kind of swipe and make that payment, that's something that is different, and we can get those credit card terminals sent out to you. There's no monthly fee, there's no setup fee or anything additional cost. It's just that the rate that is charged on that. Mm-hmm. So two different things, but yeah, that's a good question on the text to pay.
Here's another question for you, Mike. How would Weave's systems work with a telehealth program?
Good question. There are so many telehealth, teledentistry programs out there, and some of them have a means to collect payment right there. And I'm not sure what systems might be used, but if you have a balance, if you have an invoice that you want to send a patient, and if you're using a system for telemedicine, teledentistry, you can still say, hey, I'm going to send you a text right now. I'll even have your invoice in there for the consult that we did, and they can make a payment right there. So depending on the systems you're using and what is built in with your teledentistry, telemedicine systems, you can absolutely use a text to pay to collect payment on that. Yeah. So the last portion on here is that patient care and communication. What's been really cool is seeing how many offices have really been able to continue communicating and thriving because they're using Weave, or they're using a system that will allow them to continue their communication outside of the office, outside of the practice. So what I mean by that is there's a lot of systems that are maybe available now that are coming out that will allow you to do some of these remote communications. Weave is one that is a HIPAA compliant app on the phone as well. So you have that on your computer. If you have the phones installed in your office, you can also have the Weave app on your mobile phone, HIPAA compliant, so that you can go in, you can pull up the schedule, and if I needed to check on any patients on my schedule, I could click on any of these, pull up who that patient is, and see if they're confirmed, what they're coming in for. And if I needed to reach out to them, I could simply click on the call or the text button, and I could text that patient, and it looks like it's coming from the office phone number. Or if I call them from my mobile phone, it looks like it's coming from the office phone number. So with Weave, if you need to work remotely, if you have team members that need to work remotely, and you need a solution for that, Weave can help you with that by basically setting up your office communications so that any incoming calls can go to the Weave app on the phone, and any outgoing calls for your patients will look like it's coming from your office. And all calls can be recorded as well, so that you can go back and listen to anything on there. So I think that, we're going to see that need of communicating with patients, whether you're in the office or out of the office, and especially whether it's an emergency, that they need to reach out to you. Having that ability to do that is going to be key as well. Now, somebody had brought up a question about telehealth or telemedicine. If you don't have a system right now, Weave has partnered with CareConvene to offer teledentistry or telemedicine, where you can go in, you can do these consults. If you have questions on that, I'll put up my information at the end, and you can reach out. But we do have a partnership with the system that will allow you to do these consults, and you can still bill. I think there's a dental code. I can send you what those codes are, that you can still bill that patient for that consult, though it was done virtually or remotely. And I think that the last I checked, I know that Texas was one that was not allowing telemedicine at the time. I think that could be changing, because I think that this is really going to become the norm, as people are going to be leery of going into the doctor's office. And especially if they're sick, they're not going to want them in. Same thing with the dental office. It's like, hey, if they need a consult to check up on something, rather than coming in, having that opportunity, that means to safely communicate with that patient through another means. All of these things, all of these technologies and systems, they're ways that allow us to continue to connect with and to communicate with those patients in a safe manner. And I think that through all of this, people are going to remember how you treated them. And I know that there's been a few meetings that I've spoke at with Crown Council, and I love kind of ending on this. This is something that I really, truly believe in. And I believe that depending on how you interact with your patients, that's what's going to create those loyal patients. The fact that, people don't necessarily remember all the details of what you said, but they will remember how you made them feel. And by making sure that you are, attentive, you're available for them, you can reach out through text, you can address their needs, and make sure that they're feeling safe when they come back into the practice is going to be key. So for those who are not using Weave or not familiar with Weave, Weave is the system where we basically send phones out to your practice. It syncs up with the practice management software, so that when patients call in, you can see who's calling in. You have all that information up in front of you, and then you can send out, text to pay. You can send out review reminders to leave a review directly onto Google. All of your appointment reminders, and we try to do this as it really becomes like that in-office complete business toolbox, where we're tying in the phones, the texting, the payments, your fax line, your reviews, all of that kind of in a toolbox for you and your practice to operate. So with that, I'm going to leave this up here at the end. Especially, like I said, the one thing that really seems to be the only thing that a lot of us have to do in the evenings is, hey, let's go get takeout. Let's go support the local businesses. And so what we're doing is, for anyone who would like more information on Weave, or wants to see some of these COVID features, make sure that you text the word crowns to this number, 801-310-7664. Text the word crowns to that number. You can reach out to me at mike.buckner, Buckner, @getweave.com. And for anyone who would like to do a demo, what we're currently doing right now is we are giving a $50 DoorDash gift certificate. For anyone who wants to see a demo of Weave, go out, get some takeout, support the local businesses, and we wish you well, especially as you're preparing to reopen your practice. And we know that Weave has a lot of those things that will help make that a lot easier.
Yeah, Mike, thanks so much. As I start to wrap up here, feel free to start typing in any questions, anybody, but this has been recorded, and then we're providing the link to this recording. We've had a few requests for the recording, Mike, for those that weren't able to make it, so we'll provide the link of this recording on the Crown Council network here shortly. We really appreciate Weave and Mike Bukner as one of our trusted resource partners of the Crown Council, and wish you well, Mike, and your family well, and keep safe and healthy.
Thank you so much. Appreciate it.
Thanks, Mike. Thank you, everybody. Have a great day.
Thank you.